So root cause approach means exactly that. We are digging deeper for root cause of illness. And a lot of people will say to me, well, isn't that what all doctors do? I mean, isn't that like the doctor's job to dig deeper for root cause? And I would say, yes and no. I mean, I think it's their job, but I don't think that we are trained that way in the conventional system. And I also don't think that the current model of seeing patients every 10 to 15 minutes allows a practitioner to dig deeper for root cause. And so, again, it is not the fault of well-meaning physicians. It is how the system is set up for profit. And so the faster you see patients, the more revenue that you generate. And there's a lot of pressure on physicians to do that. And I also, don't get me wrong, conventional.
Well, today we're going to have episode 2 in a continuation of our series for Forum Health on restoring health, unraveling America's health and wellness crisis. And today it's my privilege to be able to be with Dr. Kristen Reynolds from our Forum Health Milwaukee office. In a minute, I'm going to have her introduce herself. And what we want to try to do in this series is talk about not only clinical matters, but also public policy matters as it applies to this epidemic in ways that we can ideally try to help take care of it and make it go away. So in today's topic, we're going to do a deeper dive into functional or integrative medicine and how it differs from more conventional American approaches to healthcare. We're going to talk about those definitions and talk about some of the reasons that we believe in Forum Health that the functional or integrative approach to healthcare actually has quite a few benefits, and we'll be going into that. But I am going to ask the viewers to please, if you are getting something out of this content, please be sure and subscribe and like and share with friends and family. So before I introduce Dr. Reynolds, I want to say that I'm one of the senior physicians in Forum Health. I've actually been having a environmental medicine practice with Forum Health since 2019. I started my medical career as a traditional or a conventional otolaryngologist. And then in the 90s, I transitioned away from conventional ear, nose, and throat medicine and surgery to environmental medicine and surgery, which is basically treating from a functional or integrative or holistic approach people that have a wide variety of persistent symptoms as a result of cumulative exposure to a bunch of different environmental threats that I'm sure we'll be talking about at least a little bit in our talk today. So I'm not going to say anything more about me, but I'm going to ask Dr. Reynolds if you could introduce yourself to the viewers and how you got involved in this kind of medicine.
Hi, Dr. Taylor. Thanks for having me. I'm Kristen Reynolds. I'm here in Wisconsin. I just to give you a little bit of background, I trained at the University of Wisconsin-Madison Medical School in conventional medicine. I went on to do my family medicine residency in Milwaukee. I joined the faculty right after and spent 20 years in academic medicine. So definitely have that conventional background. Over the years, despite, having an interest in prevention and addressing lifestyle with my patients, I was recognizing that I didn't necessarily have the tools to help people with more chronic complex conditions. And so I pursued an integrative medicine fellowship under Andrew Weil from the University of Arizona, and sat for the first integrative medicine boards actually that came out in, I think that was 2012, and it is now a board recognized specialty. And then I went on to do functional medicine training and certification, and then even a deeper dive after that into some more outside the box things that I hadn't even learned in any of those trainings, such as hyperbaric oxygen therapy and ozone therapies, PEMF, those types of things. So I stayed in the conventional realm for quite some time. And the last few years that I was there, I did open my own integrative and functional medicine practice, mainly with some of the therapies. I was still doing my medical consults in the conventional realm, but it became increasingly difficult. And COVID really revealed a lot of cracks in the system and made it much more challenging to do what I was doing in the conventional realm. So I eventually did leave in 2022 and have been doing full-fledged functional integrative medicine now at a private practice, 2 locations in the Milwaukee area, and joined Forum Health about 8 months ago.
Wow, well, it sure does sound to me like you're especially suited to be able to answer some of these questions and issues that we're going to talk about, especially because you've got plenty of experience on both sides of that fence that seems to be there between conventional medicine and functional, holistic, or integrative medicine, like we like to call our practices. So I'm going to start off by having you tell us, kind of from your perspective, kind of definitionally, how would you say are the differences between what we're calling conventional medicine and versus the way we practice more integrative, functional, non-traditional, non-conventional?
Yeah, sure. And just, before I start out with more of those definitions and what it means, I do also want to mention that the word integrative medicine, integrative to me means both and. And so the beauty of the work that I do is I can have a foot in both of those worlds, and I don't consider them different. I consider them one and the same, but really just good medicine when you're bringing everything in from all the different worlds and giving patients options. Um, so integrative medicine, we spent a lot of time when we were trying to bring in integrative medicine into the conventional system. I worked with folks, and we spent a lot of time trying to define it. What is integrative medicine? And we basically came to the conclusion that it's the evidence-informed combination of both conventional and holistic approaches and includes foundations such as nutrition, exercise, sleep, stress management, spirituality, social connections, and often herbal or natural remedies are preferred to prescription medications, though again, both and, we don't shun one or the other. And nutrient deficiencies are definitely addressed through whole foods eating and supplements when needed. And again, I try to shy away from the word alternative because that would imply we're not going to do one thing like the conventional approach. We're only going to do this alternative approach. And again, I like that we have both and I can do both in my practice. Um, Practitioners who are trained in integrative medicine often are well versed in other healing modalities like acupuncture, Ayurveda, traditional Chinese medicine, yoga, breathwork, meditation. It doesn't mean that we all know how to put needles in and do acupuncture. Some practitioners do, but we at least have some baseline knowledge of those other healing therapies and can speak to those when appropriate with patients. And then people always ask me, well, what's the difference between integrative and functional medicine? And in my opinion, functional medicine is integrative medicine on steroids. And of course, in our holistic world, that steroid might be licorice root because that would actually be the herbal equivalent of steroids. But, it really is a step further than integrative medicine. So it takes everything integrative medicine has to offer. And it digs even deeper into root cause, which I know we're going to talk about today. And we are often exploring contributing factors such as genetic makeup, toxins, chronic persistent infections, immune dysfunction, environmental triggers like I know you do in your practice. So it really is integrative medicine plus.
So before we jump into more of a discussion into root causes, let me ask you, in your opinion now, having practiced kind of on both sides, or this blend, as you say, which I really like that. Are you perceiving or have you perceived that there is any tendency on the part of one or the other of these forms of healthcare that actually puts them almost at odds with each other? Has that been your impression at all?
A little bit. It shouldn't, because in my mind, it's simply good medicine to approach things this way. Um, However, there's a belief system in the conventional medical realm among practitioners that perhaps some of these things aren't scientific or informed by evidence. I have heard practitioners in the conventional realm tell patients that, oh, taking those vitamins and supplements is just, basically expensive urine. Like you're all just going to pee it out and it's just expensive. And why would you do that? And I think that's really short-sighted, right? Because we know that our body needs nutrients for building blocks. And so I think it's not so much that physicians are ill-intentioned, but in the conventional realm, they simply have not had the training. And once you get the training, it's like it opens up a whole new realm of medicine, right? And so I look at my training at UW-Madison, which is, an amazing medical school. And from a nutrition standpoint, we had 2 weeks of nutrition, which is abysmal. And it was all biochemistry, nothing applicable. No talk of a low carbohydrate or paleo or, low fat or this or that or the other. And it really took a lot of learning on my own to understand how different dietary patterns affect people. And there's just a ton of science on that, and why we not taught more about that in the conventional realm. I also hear specialists, including gastroenterologists, and I think they have a very important place in this world. But patients will tell me that they're told by their specialists that food doesn't matter, that it doesn't matter what they eat. And it's that, to me, it's shocking that any physician would say that, because food matters so much. It's foundational. So I think,
Do you
yeah,
know
there are.
Dr. Casey Means, Dr. Reynolds?
Yeah,
Yeah, so I think she's kind of both of our heroes, but she's been kind of on the forefront lately of the political discussion or the public discussion. And she and her husband were on guests on the Joe Rogan podcast, for example.
yeah,
And both of them got to testify when Senator Ron Johnson held a Senate public hearing recently on this epidemic of chronic healthcare, chronic disease in America. That Robert Kennedy also participated in. But Casey came right out, and I would venture to say I know she's been to medical school a long time after I went, and possibly even a little bit after you went. But she even made the statement in her public remarks that as a medical student at Stanford Medical School,
mhm,
that she had virtually none of this nutritional lifestyle training that we're talking about today. So it kind of seems that it continues to be. And certainly from my perspective, having been an ear, nose, and throat, head and neck surgeon for half of my career, and then switching over to practice the way I do today, it's always been my perception that I can even use the word hostility between
yeah,
some of the conventional sides of medicine and the way we do things. Yeah, you
for
can
sure.
talk about little snide remarks about a conventional doctor telling a patient flippantly that there's no indication for vitamins because
Yeah,
it just makes expensive urine, as you said. But then it can go deeper than that. But certainly, I would say that partly since the approaches that we recommend often to our patients, like modification of diet, changing their lifestyle, managing their stress, looking at their nutrients, a lot of these things can't be patented in the way that some of the pharmacological agents that conventional medicine is more inclined to recommend as sort of a
yes,
cover up or a way to suppress some of the signs and symptoms of illness that our patients are dealing with.
right. Yeah, and I think, one of the things you are also alluding to is, medical training and the fact that it is highly pharmaceutical driven. And And so what we learn in medical school, sadly, is a pill for every ill, a drug for every bug, and that's kind of the model. And I didn't necessarily recognize it when I was going through medical school, because I only knew what was being thrown at me, right? But it was probably 10, 15 years later when, reports were starting to come out in the mainstream literature about how heavily funded medical schools were by big pharma. And I think that is really problematic because that training is so ingrained in you from a very, from the start. And that's kind of all you learn is that pill for every ill. You don't learn the healing aspect of medicine, which is really very important, and I remember being in the conventional system, and there was a time when they were really trying to clean things up those past 5, 10 years that I was there, and they were giving us all grades. I don't know if you remember this, but we were getting graded on how many statins we were prescribing for patients with abnormal cholesterol, or how many of our patients were fully vaccinated, or how many of our patients were on blood pressure medicines and keeping the blood pressure at a certain level. And I actually remember the care management team coming in and having these interventions with me, the physician. And I at the time, I was the only person in, a 40,000 person healthcare system providing this type of care. One of a few. There were a few of us, but pretty highly sought out because it was still in an insurance covered setting, and people wanted this type of care. And there was no marketing; it was just all word of mouth. But booked out, months or years, and so definitely no lack of demand for patients wanting to address things in this way. But the healthcare system was coming to me and getting on me because I had an F in statin therapy. First F I've ever had in my life, because I didn't prescribe enough statins. And then they would say, Dr. Reynolds, and I'd say to them, my patients, they they come to me because they don't want to be on statins for their cholesterol. They want to talk about diet. They want to talk about other things like phytosterols or, other ways of managing cholesterol. And they said, well, you know, maybe you could try a little harder and talk to them a little bit more and kind of push them to
That's
start that.
crazy.
And I was like, why would I do that? They come to me because I'm meeting them where they're at. I'm hearing them, I'm listening, I'm partnering with them. I understand they don't want a statin. Why would I do that? So I just kept getting an F in statins.
That's something. Yeah, there's no question that these so-called treatment guidelines that are definitely skewed toward the use of prescription pharmaceuticals, and it seems like often the newer and more expensive ones at that,
Yeah.
seem to really, there seems to be a lot of encouragement, urging, if you will, on the part of some of the powers to use many of those. And I think a lot of that maybe does have to do with a profit motive on the farm of some of the pharmaceutical companies. We always, when we start talking about these kinds of issues of this epidemic, I always say you can follow the money, because
Oh, absolutely.
as sad as it is to say that, the
Yeah.
almighty dollar seems to be behind most of this. Whether you're
Mhm.
talking about ultra processed foods, or the argument of a statin drug versus uh, more holistic or natural type of approaches. Yeah, it always at the end of the day seems to be about the money, who's going to
Yeah,
benefit financially from the issue.
absolutely. Absolutely.
And unfortunately, us commoners, the people, the doctors and the patients, we don't seem to be that much in the integrative thought process of all that, oftentimes.
Yeah.
Yeah,
Yeah. I mean, can we talk fluoridation of water?
of course we can. Is there something
Okay.
wrong? Is
So,
there something wrong with fluoridation of water?
I mean, it's interesting. Many of us who have dug deeper on these issues have known about the concern with water fluoridation for quite some time. Um, and I think it's very hard for the general public to hear that perhaps this wasn't the best idea, right? Because we are of the belief that this was an amazing public health intervention, and that this has decreased dental caries for a lot of people, and it's a good thing. However, I like to say for every action, there's an equal and opposite reaction. Okay, maybe not equal and opposite, but everything we do, there could potentially be a downside. Okay, so you've decreased dental caries by 25% for a portion of the population, but at what risk to the entire population? And, I dug into this deep when my children were very young, probably 2 or 3 years old. They're in their 18, I have 18-year-old twin daughters. And one of my daughters got a topical fluoride application, the tooth enamel thing, and or what's it called? Varnish, fluoride varnish. And I kind of knew better than to do it, but you're a mom and you're kind of overwhelmed at that time, and you get pressured by the dentist to do it. And I'm like, well, it's topical, maybe it'll be okay. But these kids swallow a lot of that.
Mhm.
And fluoride systemically is not a good thing. And we and my daughter actually became very sick after that and couldn't sleep, couldn't put her brain to sleep for about a month. And it was the worst, one of the worst months I remember as a mother, where it's just like being up at night trying to console this child who was exhausted and wanted to sleep, but clearly her brain was on fire and she just could not go to
Mm.
sleep. And as I dug deeper about, with fluoride, it is a neurotoxin.
Mm.
And it also increases risk for osteosarcoma. And there has been concern for many years about decreased IQ with systemic fluoride. And now, just recently, this has come to light in the mainstream media. I think there was a recent court case or something that
Mhm.
um, affirmed
Exactly.
that this lowering, what was that? Do you remember? Was it a court case or
Well,
something that
they've
confirmed the
actually
lowering
come
of?
out with some recommendations at some of the upper levels to
Yeah,
completely ban the use of
yep,
fluoride, at least in water systems and things like
yep,
that,
yep.
because it's been pretty clearly shown scientifically now that it does lower IQ if you
Yeah.
administer it to a population.
So exactly. And so, I feel like sometimes I'm caught between this rock and a hard place because I have people of my parents' generation who really do believe that they saw a lowering of, people who had just teeth rotting out to all of a sudden, improve dental health. And perhaps they did, but that was also the same time when, fluoride in toothpaste became much more available. And if people want to apply fluoride topically to the teeth, that's not a difficult thing to do, but to put it in the water and force it systemically among a population was, I think, one of the worst public health interventions. And now, finally, with RFK bringing this to light, I think we do have an opportunity to maybe reverse this action that has resulted in maybe not such good outcomes. It's hard to
Exactly.
prove, but I mean, I
Well, I
think
think
we
we are
definitely
going to see, I think we are going to see a change in the attitudes on that. But I mean, it's only been a few months ago that I was having my teeth cleaned and they said, oh, and we want you to get this fluoride application at the end. We want to put these fluoride trays in your mouth. And I just politely declined and said, no, I think I'll take my chances. But yeah, even today, no,
a lot of
that's
pressure.
I'm glad you raised that point. It's interesting because when my oldest son, who's in his 40s now, when he was young, where I was stationed in Germany at the time, the pediatricians actually told my wife that my son needed to get daily fluoride drops orally,
Mhm.
administered orally, because there was a fluoride deficiency and
Mhm.
that he needed more fluoride. And later on, both my wife and I just shake our heads and say, why in the world, were we told to do that? But again, that's all the pediatricians knew, they didn't know the
Well,
science.
right. And I think if you look back at it historically, I think that there was an intervention there with the sugar industry. They didn't want it to come out that sugar actually was more the problem. Let's just fluoridate the water, rather
Exactly.
than actually blaming what was probably the more likely culprit, and it probably still is.
Yeah. So, just to kind of extrapolate or dovetail off of that, sometimes when we talk about the kind of medicine that we practice, functional integrative, sometimes we even use the term root cause medicine. What does that mean
Yeah.
to you that you practice root cause medicine?
Yeah. Yeah. So root cause approach means exactly that. We are digging deeper for root cause of illness. And a lot of people will say to me, well, isn't that what all doctors do? I mean, isn't that like the doctor's job to dig deeper for root cause? And I would say, yes and no. I mean, I think it's their job, but I don't think that we are trained that way in the conventional system. And I also don't think that the current model of seeing patients every 10 to 15 minutes allows a practitioner to dig deeper for root cause. And so, again, it is not the fault of well meaning physicians, it is how the system is set up for profit. And so, the faster you see patients, the more revenue that you generate. And there's a lot of pressure on physicians to do that. And I also, don't get me wrong, conventional medicine is wonderful in many, many ways and works well for acute care and trauma. Okay. If I'm in a car accident or if I have a heart attack, I'm really grateful to be in the United States to have access to having a heart stent or, a level one trauma center. But when it comes to chronic complex health concerns, that's where the conventional medical approach does fall short. We place a lot of band-aids, and sometimes those band-aids have bad side effects and still don't fix the root cause. So here's an example of simple root cause approach. So take reflux, gastroesophageal reflux disease, GERD as an example. Heartburn is another name for it. In the conventional medical approach, you might go to your doctor, describe that sensation. You might get the diagnosis of reflux. You might get a prescription for omeprazole or some other acid blocker. Maybe they'll mention, raise the head of your bed at night, or, stay away from tomatoes and chocolate and spicy food in the evenings, or foods that are triggers. But there's not much time, in the visit to do much more than that. And, unfortunately, now that person is on a medication for who knows how long. I mean, they may never come off of it. It depends if anybody looks at it and goes, oh, maybe that's a medication that's associated with some risk in the long term and tries to get them off of it. But from a more of a functional or integrative medicine approach, we would say, okay, well, why are things in the digestive system going backwards? They shouldn't be going that way. You shouldn't be feeling heartburn. They should be going down and out, right? So why is this happening? And various reasons why that can happen are maybe there's not enough acid. And sometimes we'll give apple cider vinegar or something as a test to see if that helps. Sometimes it's a food sensitivity. I think about 50% of my patients who I take off of gluten, their reflux resolves. Infections like Helicobacter pylori, other, toxins, and also like the nervous system and, this chronic stress and sympathetic drive that we have. The gastrointestinal tract needs parasympathetic, the rest and digest. And when we're constantly in stress mode, we are in that sympathetic space where we're not, the nerves to the gastrointestinal tract aren't working great. And there are ways that you can kind of work around that and fix that issue. So, by addressing those root causes, you can often heal that underlying root cause and avoid having to be on an acid blocker for a lifetime.
Exactly. Yeah. And in my practice, I see a lot of people that are living in an indoor moldy environment. And I know when patients swallow mold toxins, that
Yeah.
seems to correlate very strongly with those symptoms of acid reflux and heartburn. So that for me, that's a little tip off that maybe they're inside some mold. But yeah, in my practice, most of my environmental medicine patients, by the time they get in to see me, Dr. Reynolds, they already have a whole bunch of different symptoms. Certainly fatigue is probably at the top. Brain fog or some problems cognitively are pretty high on that list. Anxiety, various aches and pains, a lot of times digestive symptoms, hormonal symptoms, immune and allergy symptoms. So they come in with a bunch of symptoms. And a lot of times they come in also with a whole list of diagnoses. Each one of those symptoms has its own diagnosis. And sometimes there's a different prescription medicine for every one of those symptoms and diagnoses. But I always tell my patients that in my experience of doing this over the years, I find that often it's just a few root causes, maybe acting in concert, that actually is contributing to all of these different symptoms, and they actually all oftentimes tie together. And that's why this concept of looking for root causes can be so important. And I think in my practice, even maybe in many cases more important than trying to get a medically correct diagnosis, which is usually has nothing to do with the root cause.
Right, right.
But I
Yeah.
think I always tell my patients that it's almost like you're playing a detective like Sherlock Holmes to try to get a thorough history and understanding of all that patient's cumulative exposures over their lifetime, whether it's
Yeah.
the fluoride or whether it's the mold or whether it's a tick bite or being around too much 5G. There's just so many different things that can contribute cumulatively to these persistent symptoms of chronic illness. But
Yeah.
I think root cause is important.
Yeah, very much so. And it reminds me of Dr. Sid Baker's TAC rule. You probably remember he's one of like the godfathers of functional medicine. And he always used to say, if you have, two tacks if you step on two tacks, you got two tacks in the bottom of your foot and you take out one, you haven't necessarily decreased your symptoms by 50%. You still have a lot of pain. You have to address both or all in many cases.
Exactly. And, that's like Dr. Bredesen talks about the holes in the roof
Mhm.
when he's talking about patients with dementia. He's a neurologist that practices integrative neurology and approach to Alzheimer's. And he always talks about all the holes in the roof that you have to fix if you're going to really be able to get to the bottom of some of these chronic illnesses.
Yeah, agree.
Well, let's talk a little bit about maybe some of the advanced diagnostics that we use in our practice approach to chronic illness. How would you say it differs from maybe what you did when you were more on the conventional side?
Yeah. Yeah. Um, well, I was thinking we could just talk a little bit about like cardiac or vascular health because that has really been a door that has opened to me to understand all these advanced markers. And, one example in that arena would be in the conventional realm. We are really only looking at 5 different risk factors for heart disease: cholesterol, diabetes, obesity, hypertension, smoking. But actually, there are 400. The literature shows that there are around 400 different factors that contribute to vascular disease, including the ones mentioned, and then genetic makeup and toxins and chronic infections, autoimmune conditions, COVID. We've seen a huge surge in vascular issues with COVID. And when I say vascular issues, I'm talking about heart disease, atherosclerosis, stroke, but it's all blood vessels, right? And, in the conventional realm, I mean, we were just looking at a basic lipid panel, and there's this, cholesterol hypothesis of heart disease, where, oh, if you have high cholesterol, that's why you have heart disease. But cholesterol is actually the body's band-aid. Cholesterol comes in to cover the wound, so there is some sort of insult to the lining of the blood vessel, and then cholesterol goes up so that it can patch that wound. And it's just the body's healing response. So yes, there's an association with cholesterol and vascular disease, but it's not, you know, the big thing that we once thought that it was. And so really the question should be, again, root cause, what caused that vascular wound in the first place, and address that root cause. And so when we're getting advanced diagnostic testing in the cardiometabolic realm, we might be looking at things like cholesterol, but we might also get a whole panel that's looking at inflammatory markers like C-reactive protein. That might give us a clue there's some sort of low-grade infection brewing in the body, maybe a dental infection that's quiet and the patient doesn't feel, or an elevated homocysteine that might suggest, oh, this patient has a genetic methylation defect and they're not methylating well. And so that homocysteine level is rising, and that certainly can trigger vascular issues. And so these advanced cardiometabolic panels will look at a lot of different things. I love to give an example of my mom, who is about the healthiest 75-year-old woman on the planet. She eats well, she exercises 2 hours a day, she, has all the good lifestyle habits and healthy sleep and all the things. And 3 years ago, we were shocked when she had a TIA or a mini stroke and ended up in the emergency department. And of course, it was a TIA or a mini stroke is short-lived. It resolves and your mental capacities come back to you relatively quickly, but it's a huge sign that there's some sort of vascular issue going on, most likely. And, the conventional medical approach reflexively was take a statin, Lipitor, cholesterol-lowering medication, and take an aspirin every day. And she has the most beautiful cholesterol panel. She's got high HDL, which is protective. LDL and triglycerides are normal. There's no insulin resistance going on. She didn't really want to take a statin. She just felt, and she didn't know why, but intuitively she just did not want to be on that medication. I'm like, okay, mom, listen, let's get an advanced cardiometabolic panel and let's really see, let's dig a little deeper into what your cholesterol, the size of your cholesterol and the different types and the breakdown and all these inflammatory markers. Her whole panel was beautiful. except for an elevated homocysteine. And in our family, we have methylation defects. We have MTHFR genotype. And so, we put her on methylated B vitamins. We got her on a little bit of lumbrokinase, which is a blood thinner, because she didn't tolerate the aspirin. She got terrible bruising with the aspirin. So, we did the methylated B vitamins and lumbrokinase for thinning the blood. And so far, fingers crossed, she's 3 years out without another event. But it was just, to me, a great example of how the conventional approach is very reactive, not necessarily at the correct thing for every person. It should be more individualized.
Yeah, because of those 400 things that you mentioned, beyond just the five that most conventional doctors would focus on, that can even include infections like, for example, a tick-borne Lyme type infection, or you
Absolutely.
mentioned COVID, or even in some people, the response to the vaccine for COVID. So there's a lot of other things that can lead to the kind of inflammation that can end up causing damage to the vessels, especially
Yeah,
the very small ones.
yeah, absolutely. And I do a lot of that work in my practice too. So I totally hear you. Lyme, tick-borne illness, we're in southeastern Wisconsin. There's a ton of Lyme here, and I'm really aware of that. And yeah, it damages the lining of the blood vessels. Mold illness is a big area of interest for me. And then COVID. I mean, the spike protein from COVID-19 virus and the COVID-19 vaccine has done so much harm to the population. And day in and day out, I am seeing this on a clinical level. And I tell people I could see long COVID, long vax 24/7 for the rest of my life and never see all the people who've been affected by it.
Yeah. And it's interesting, but as time goes on, we're learning so many new things about underlying root cause. Like I've been really interested lately in this whole concept of the glycocalyx, which is
Mhm.
that thin layer of material that the inner lining of our blood vessels builds, that acts like a Teflon shag carpet that allows the blood cells to flow smoothly and evenly. And a lot of times when there's inflammation from whatever cause, that little healthy lining gets damaged. And then that can lead to little injuries to the inside of our blood vessels that can cause things like calcium and cholesterol to then be laid down, as you said, to kind of act as a band-aid or a repair mechanism. But then that can also cause blockage, over
Yeah,
time.
totally. Did we go to the same conference last year in December? Longevity Fest. I went to their vascular pre-conference and they talked about the glycocalyx and it was so good.
Yeah, that's really exciting. I've actually been using a lot of some of those supplements that are designed to kind of boost the ability of the body to make more of that glycocalyx. And they're even coming up now with some more newer advanced techniques of how to measure when the microvascular health isn't what it needs to be. You mentioned homocysteine as a marker for methylation, which we could even go into a little bit more about methylation because, yes, it's important for healthy blood vessels, but geez, methylation is important for so many things in our bodies, our brain chemical balance and our hormone balance. So there's many, many other things that can be affected when we have methylation issues, but for sure our blood vessels, no question about it. So in your experience, having practiced now in this more functional, holistic, integrative way. What kind of comments could you say on things that you've noticed from your patients of how they can actually tell the difference versus
Yeah.
more conventional approach to care?
I mean, they get better. They feel better, and that's the most important thing. Like the labs, yeah, I mean, labs and diagnostic markers and, objective things are important, don't get me wrong, but really what you want is your patient to have good quality of life and feel a sense of vitality and be able to work and play and learn and socialize and just have a fulfilling life, right? And so my practice, your practice sounds very similar to mine in that patients come in really not feeling well. They've got brain fog, they've got pain, they've got insomnia, all fatigue, all the things. And then we bring in these interventions and they come back and they say, I'm able to play pickleball again. I had one patient who felt so much better after treating her Lyme and her mold. She went out and played pickleball and then she tore her Achilles tendon. Oops. But I mean, they feel better. They get back to things in life that they had been missing for so long. And that's what's most important. And when we address these things, they get better.
Exactly. I've often heard it said that functional medicine doctors treat for results. Not they don't just treat labs and x-rays, they treat to make their patients well again. And what I find is that all these many symptoms that my patients come in with, they just tend to dissipate and just kind of drift away. And sometimes it can be just something as simple as, like you said, getting them off gluten or reducing their sugar or helping them manage their stress. Or maybe it's just to put a little more of the B vitamins in if they have high homocysteine, help restore their methylation pathways. There's so many things that we can do. I mean, their whole antioxidant, oxidative stress, we haven't even touched on. But in my practice, that's huge. How do you get people back in balance as far as oxidative stress? It's probably one of the biggest things I do for people.
Yeah.
But let's talk a little bit about how what we do. Yeah, we see these really sick people that come in, and our goal is to try to make them healthy and functional and happy. But what about the way that this can also play a role just in terms of prevention and wellness? What's been your experience there?
Well, I mean, it's huge, if you can do, I like to talk about the foundational pieces, and I kind of describe that as like the last part of the word wellness, NESS, nutrition, exercise, sleep, stress management. I usually add on a couple like, spirituality and social connections, but the NESS of wellness is foundational. And if we, that's the first thing we do, right? We want to help people with all of those. We want to help bring in all those foundational pieces, the healthy whole foods eating, regular exercise, both cardiovascular and strength training, quality sleep, maybe monitoring the sleep with, Aura or some sort of tracking device. And the stress management, as you said, is huge. We can't eliminate stress from our lives, unfortunately, but we can change how our body responds to it. But just those things probably could prevent 90% of chronic illness. You and I probably see the 5 to 10% of people who that's not enough. They need more than just the NESS. But yeah, people can lead a very, productive, well life, well into their later decades with simply a foundational approach. Get rid of processed foods. That's number
Yeah.
one, right?
Well, and it's amazing because the kind of things that we might do to help somebody with all of these symptoms of chronic illness, one of these people that's so sick, almost to the point of disability, our approaches often are not that different than what we would just do to help a healthy person to stay healthy or
Right.
to help a person enjoy more longevity and quality years of their life. Not really that different. The same principles apply. In fact, when I tell my chronically ill patients that a lot of the interventions that we're going to do for them are just designed to improve the way their cells work, their cellular health and their cellular physiology, and that ultimately, if we make them well, then we just turn right around and call it a wellness protocol or a longevity protocol. And it's not anymore a get well protocol because then now they're well, but it's the same basic principles.
Yeah. Yeah.
Well, maybe we could talk a little bit about some of the evolutions that we've seen in functional medicine over the years. I've certainly been doing it probably a few years more than you have, but I know that we both, I'm sure, have seen so many different ways that the way we're practicing is evolving. And maybe as we talk about this, we could just kind of make a little aside to the the question of science. Like you said earlier in our discussion, that a lot of people sort of maybe look askance at what we do and say, well, it's not scientific. I mean, you even hear people talk about functional medicine being quackery, which is obviously misinformation, disinformation. But let's as we talk about the evolution of our practices, maybe let's just tip our hat a little bit to some of the extensive science that's happening in our area of practice.
Sure. And so just to kind of answer your first question, because I think initially you were asking like about the evolution of functional medicine, and you definitely you have more experience in this than I do, but I mean in my own experience over the past 5 to 10 years, I think some of the biggest advancements are in this more precision testing, where we're looking at more genetic testing and even gene therapies like the SOT, or the single oligonucleotide therapy, which I'm getting trained in. I don't do yet, but is kind of based in a genetic type of therapy. And I think that's, really very progressive and new. But then also there's a return to old healing therapies that were pushed aside in the mid 20th century, but they're now experiencing a resurgence. And one of my favorites is ozone therapy. I use a lot of ozone therapies in my practice, whether it be blood ozone, ear ozone, even prolozone. And last night when I was kind of considering some of the questions you were going to bring about in our discussion, I just went to PubMed and I put in the word prolozone and I got 1,000 hits. Sorry about the emoji. I don't know how to turn those off. the, um, but yeah, 1,000 hits on prolozone, and a lot of the population has never even heard the word prolozone. You can also put in the words oxygen ozone or joint ozone or whatever, but there's a ton of science on it. And, so shifting now into science-based, I think that everything we do has a scientific basis. And when I did my training with Andrew Weil back in 2010, 2011, he liked to describe this sliding scale of evidence. And to back up before I explain it, in the 20 years of academic medicine, for me, training medical students and family medicine residents, I started to find that the learners who eventually became attending physicians were paralyzed by the term evidence-based medicine, completely paralyzed, could not recommend a therapy unless they had a double-blind randomized placebo-controlled trial. And I thought, that's a problem because there's not going to be a double-blind randomized.
That's a unique observation, but now that you say it, no, I can
Yeah.
completely agree with that. Yeah. Have
Well,
you
and
ever
I
heard the
was a
term
little bit
analysis
too.
paralysis?
Yeah, it is
Yeah,
kind of
I
like
think
that.
I think that's what you're talking about.
Yeah. And so evidence-based medicine for the layperson is this idea that we need to find some sort of scientific article and we rank them. We rank them low evidence to high evidence. Low evidence might be a case report. Highest evidence is somewhere in the middle is the double-blind randomized controlled trial. Everything's based on that. And then you've got your reviews and meta-analyses, right?
Meta-analysis.
Those are the highest. Those are the highest levels, which you can find both of those on Prolozone, by the way. Um, but anyway, we get stuck in this thinking of just the science, just the literature. Show me the science. Well, actually, when the phrase evidence-based medicine was created, the person who created it, it was meant to be like a Venn diagram. So think about three circles that all overlap in the center. And the three circles in that Venn diagram were the science or the literature, show me the article, the clinician experience, which is incredibly important, and the patient preference. And that brings back everything I was discussing before about patients coming to us because they don't want to be put on a statin or they don't want to be forced to do something. And so then we work with them to figure out what the best treatment approach is for whatever their condition is. So those three things, the science, the clinician experience, and patient preference, are really what evidence-based medicine is meant to be. However, in academics, I think we have forgotten two of those circles. We've forgotten about patient preference. We've forgotten about clinician experience. And those two things are really important. And all we are relying on is show me the article, show me the double-blind randomized placebo-controlled trial. And that's a problem. And that's where I say physicians get paralyzed, because if they don't have the double-blind randomized placebo-controlled trial, they're not going to do it.
Yeah.
And, if we go back to the idea of the sliding scale of evidence that Dr. Weil talked about when I did my training with him, he would talk about kind of like a 10-point scale and this sliding scale where, say, you have something very toxic and potentially could cause a lot of harm, like a chemotherapy drug. You want to have some pretty decent evidence that that could help the patient because there's a lot of potential for harm. On the other hand, if you have something as simple as breath work, I'm going to ask the patient to breathe a little more slowly, a little more deeply, a little more regularly. Do I really need a double-blind randomized placebo-controlled trial for that? Probably not. It's probably pretty safe. And then there's everything in between.
Yeah.
And that's what we're doing every day in medicine is we're on that sliding scale. We're in between and we have to think about risk and we have to think about benefit and we have to meet the patient where they're at and utilize our experience. And that's what it should be. But I think we've gotten away from that in the conventional realm.
In my history, ever since I was young, I was very scientifically minded. I mean, mathematics, physics, chemistry, biology, zoology, all that sort of thing. So when I first started doing more integrative medicine, which for me just naturally followed if I really wanted to get my patients well, when I started hearing this business of what I was doing being pseudoscience or quackery, I mean, I was very offended
Yeah.
because,
Yeah.
I mean, there's not probably nobody more scientific than I am as far as really needing to understand why things work the way they do. But you're so right that there's also this spiritual or non-definable, factors as well that you have to be considerate of. But yeah, I think one of the things I would say that I have seen be an issue about the science behind some of the things that we do, and when you think about it, it's pretty easy to explain why. But we talked earlier about the money from the pharmaceutical companies going to fund medical schools and often to fund research. There's a lot of the things that we do that there isn't potential profit in. Like, let's just take your breath work.
Right.
Who's going to be able to benefit from a patient getting well by breath work? Well, the answer is nobody but the patient, really. But, and yet on the other side of the coin, if you're talking about omeprazole, an acid blocker, or a statin drug to lower cholesterol, I mean, there's a lot of profit. In fact, there's billions of dollars in both of those drug categories, to the pharmaceutical companies. So it's going to be way more likely that you're going to find some studies get done to prove that every patient needs to be on a statin or every patient needs to be on omeprazole. And nobody's going to really be too worried about how much sugar we're eating or what kind of breath work we're doing or how we're managing our stress. But I have seen that be a big deal. And one of the places that it is a little harder for functional medicine practices to do good research because there's often not the money in it because of the fact that there's no profit generating prescription that we're looking at.
Right. Right. Yeah. And it also, with the follow the dollar, as you've mentioned, and the profit generating pharma, I mean, I think we also have to look at, whether you want to talk about this or not, but, the censorship and suppression of some of the science that has showed otherwise, right? Science that has showed that, old repurposed medications work in the setting of COVID. And, I don't know how much we want to get into that, but I mean, it's real, and if you think that anything that goes against the COVID vaccine would be aired on the nighttime news, well, you've lost your mind because who pays for the nighttime, the 5 p.m. or 6 p.m. news? It's Pfizer. And so you can't say anything negative about that drug or that intervention. And that's a problem. So that gets into the media and being controlled by big pharma and big ag and all the big interests. And there's been a big suppression of the science behind older repurposed drugs and these types of things that we're doing and finding great success in our practices.
Yeah.
And yet there's good science. People will I don't even argue about it anymore because I don't need to convince people that ivermectin and hydroxychloroquine work for COVID, because the people who come to me know it and they want it. And it's like, I don't have to have that conversation. But during COVID, it was frustrating because, there was sort of this, holier than thou thinking that, and this statement that kept coming over and over, follow the science. And it was like, well, actually, not so sure you are following the science, because there are over 100 studies that show that ivermectin works for both prevention, treatment, and long COVID, and there are over 400 studies that show that hydroxychloroquine works. And,
There was
I
actually
always
quite a bit of disinformation about some of those things.
lots of disinformation. And, the interesting thing to me, and this is an example that I give to people, you know, I remember in spring of 2020 when we started develop, I was still in the conventional system at that time, and the hospital protocol for inpatient COVID patients, the hospital protocol had hydroxychloroquine on it. I think a lot of people have forgotten that. And there were two major studies that came out like in early June of 2020 in two big medical journals. One was, I think, New England Journal, and the other one might have been JAMA. Um, Big studies, like reviews, meta-analysis. I can't remember what they were, but they were big. And both of them said hydroxychloroquine is dangerous and doesn't work for COVID. And immediately, I remember the Friday that it happened, hydroxychloroquine was pulled from the hospital protocol. Within a week, all of my, email groups just blew up, and people were going, "Has anybody looked at these studies? These studies cannot be right. These studies are too big. There's too many people in them. This couldn't have been done this quickly." June of 2020. Well, within a week or two, they found out both studies were fraudulent studies, and they were pulled from the literature,
Retracted.
retracted. But that story
The
in the
damage
mainstream
was done. The
domain
damage was
never
done.
changed it. What's
Yeah,
that?
the damage was done.
The damage had been done. And hydroxychloroquine never came back on the protocol, and it was demonized after that, despite those being two fraudulent studies and 400 plus studies showing it's safe and effective. And I mean, I even remember, the New York Times a month or two later had an article, rating the different potential interventions for COVID on like a ABCDF, and they put the hydroxychloroquine on F and cited those two studies. And I thought, shame on you, New York Times, shame on you. And now I never believe a word you say.
So they wanted to give you an F for hydroxychloroquine and an
Yeah.
F for not using
Yeah.
statins.
Yay. Yay
That's
me. Yeah.
that's pretty good. I love it.
Apps.
Well, let's talk a little bit about maybe the way that this kind of approach to healthcare, it's changing. Are you visualizing, or are you experiencing that among the community at large, we're seeing a shift?
Um, as in more people flocking to integrative and functional
Yeah,
medicine?
I would just say people's interest, people's beginning to have a little bit of skepticism, if you will, toward some of the things they're hearing on the 5 o'clock news and through
Yeah.
some of the
And
avenues.
I think the last 4 years, with COVID and all the aftermath, has really caused people to step back and question things, and for good reason. And so there has been a loss of trust in government, media, healthcare, and people are digging a little deeper. They're not just listening to the mainstream news, but they're listening to podcasts, and they're finding that many of these things are much more nuanced and complex than they appear on the evening news. And so once they start finding some of these things, then and finding people in the community who can address these and provide this type of care, I have seen a lot of people coming to the integrative and functional world because of what has happened in the past 4 years. And I think it was happening a little bit before then, but it was really the push or the nudge that some people needed.
No, I agree. I agree with you completely. In fact, of course, the patients that come to you and I are definitely the ones that are going to be leaning in that direction anyway, because they know that's the way we approach the problem. But One of the things that comes up in my practice a lot of the times is I see a lot of patients that are seeing functional and integrative providers on the one hand, and then they're seeing more traditional, conventional medicine, practices on the other side. And some people tell me, "Oh, well, I don't think I'm going to tell my other doctor that I'm seeing you or what you're doing for me." And I always kind of take a different attitude toward that because I have found over the years that when I communicate and reach out to a conventional doctor and kind of explain to them and the kind of terms that I can use based on the science that I know and my experience of many years now, a lot of times I find that it's exactly what you said earlier, is that there's ignorance on the part of some of these more conventional people. And that once you give them some of what we know, it's amazing. I've even had a lot of providers that have actually come to me now as patients, and wouldn't probably have done that, until they began to understand some of the things that they've learned in the last few years.
Yeah. Yeah,
And I do think it's
absolutely.
it's really important for us as successful, functional, and integrative providers to do what we can to bring the whole field of medicine up,
Hmm.
you know.
Yeah, I agree. How do you approach, and what is your take on, you know, the resistance with some in the conventional world to even drawing like a 25 hydroxy vitamin D blood level? Like, why is there such resistance with that? Because there's so much. I have patients coming in all the time, and we talk about what labs are going to draw on. I'm going to draw some nutrients on you, including a vitamin D, and they're like, "Thank you so much. I've been begging my conventional doctor to do that, and they refuse." And I'm like, I don't understand that. I don't understand the refusal. I mean, there's so much science on vitamin D and all the good things that it does for immunity and bones and brain health and all the things. What is the resistance there?
Well, that's a great question. And, Kristen, honestly, that question goes really, really deep, really deep. And I honestly believe that at least some of it has to do with the fact that some people are so absolutely convinced based on information that may be incomplete at best and downright false at
Mhm.
worst, that we are seeing some people that just cannot be convinced otherwise. And
Yeah,
I mean, it kind of hurts me to say that because I've even experienced this within people that are very close to me.
yeah.
And even with my background of training and experience as a scientist and as a physician, a healer, and this is going to probably choke me up, but to see that in some cases I can't convince people,
Mm.
regardless of how strongly I feel about it, that there is just so much disagreement, so much conviction to the contrary that I think in some cases you're literally barking up the wrong tree.
Yeah.
But that's a great
Yeah,
question that
no,
you ask, and it's one that really affects me deeply as a
yeah.
person.
Well, and I think we've all been affected by it. I mean, those of us who have looked at things differently and dug a little deeper sometimes are seen as quacks or, like you said, just that this is misinformation because the mainstream media, government, healthcare have done such a good job at uh, driving this line of thinking into everybody's heads, and there are definitely I don't want to go out there and necessarily try to bark up a tree that I know I can't, it's the wrong tree, that I'm not going to be able to change somebody's mind. I want to try to approach every person who I meet with curiosity and compassion because I know I'm not going to necessarily change their mind on any line of thinking, but if I can't change their mind, maybe it helps if I at least ask questions and try to understand where they're coming from. And I may never change that line of thinking, but at least I can be curious and have some compassion. So that's what I'm trying to do. I don't know. I'm
No,
a very
I
small.
think that's an excellent way to deal with these kinds of differences of opinion is really just try to make questioning statements that will allow other people to think and articulate their
Yeah.
beliefs.
Well, and that's kind of how we got in this bad place is refusing to listen to one another, refusing to listen to an opposing point of view. And I don't know, science has always been about discussing opposing point of views and learning and evolving in the way we think. And it's hard to see that as a society, we're no longer able to do that on many levels.
Yeah, and as a scientist, and I know you probably feel the same way, that's exactly how we approach this. We come up with a hypothesis of what we think is the truth, and then we design ways to approach the problem to see if we can prove it one way or the other. And when we start to see situations where people are purposefully not following that approach to truth, it's hurtful. I mean, at least to me, it is.
Yeah, it definitely can be hurtful. And I've had to learn over the past 4 years to just keep my mouth shut in many settings. And it's hardest when it's with family and people that you're close to, people who you care about and you'd like to have the conversation with, but you just can't. Um, so
Exactly. Yeah, well, and it goes beyond just healthcare. I mean, it really goes to so many of the issues that we're facing in the United States today. Not just this chronic epidemic of chronic illness, but economics and military and all kinds of other areas that we're dealing with, right now
right.
as a country. Well, I
Well,
think
and I wanted to say one more thing, if you don't mind, because you had asked about, the evolution of functional medicine. And the other thing that I want to mention is that science has shown that it can take, on average, 20 years for healthcare to bring new science from the bench to the bedside. Okay. From the basic research to the patient. What I like to say to that is my patients don't have 20 years to wait. My family does not have 20 years to wait. I don't have 20 years to wait. I think in the world of functional medicine, we bring the science and the research in more quickly based on that sliding scale and first do no harm. If there's pretty good data that we're not going to hurt somebody with an intervention and the science is still young, but we've tried all the other things, why not try it as long as we're not going to do any harm? And so that is also one of the ways in which functional medicine evolves much more quickly than conventional medicine because they might be waiting 20 years for that, bench to bedside.
so true. I've really enjoyed this discussion with you today, Dr. Reynolds, and I really appreciate your thoughts and ideas and for participating with us. And just to remind the viewers that this is an episode in a series. I think the next episode that we're planning to present is going to be delving into a little bit more about more of the public policy issues, which we have certainly danced around some of those today, no question about it. And then we're going to be talking about other things in the future, more about ultra processed foods, and we're going to be talking about toxins. We're going to be talking about detox and maybe drilling down a little bit more. But any parting comments? I know that you had mentioned to me earlier about a new website. Why don't you mention that to our viewers? I think that's very exciting.
Yeah. Well, so my parting comment is there is hope. And I tell every one of my patients that when they come in to see me. A lot of these people who come into my office have just been through the ringer with the conventional medical approach. They've been to multiple specialists. Nobody can figure out why they're feeling unwell. All their labs are normal. They've just come up against these barriers. And when they come in and they tell me their story, and I listen, and I have ideas on diagnostics we can do to figure things out in treatment plans, sometimes they just start to cry. I have a Kleenex box right here. It gets used often, but I think there's such an emotional release when your story is finally heard and you find somebody who can help you on this journey. And I always tell them there's hope. Okay. Don't despair. There is hope. We will figure this out. And I'm on this journey with you. And so I just wanted to leave to kind of wrap things up today with the idea that there is hope. I think there's hope for healing, whether it be on a one-on-one individual setting, whether it be healing our country, whether it be, healing our food system, whatever it might be. And there is a new website out there, policysforpeople.com. And I hesitate to bring it up because it's brand new and I don't know if it's really going to do what it says it's going to do, but it's an opportunity for individuals to get involved and to vote for policies that we want, whether that be changes, eliminating dyes from the food system. They don't have red and yellow and blue dye in Europe, but we allow that here and we don't need to. There's no reason for it. And it's neurotoxic, as you know, with the work you do, especially in kids and a lot of sensitive people. But, policies like that we can start bringing in as a society, and you can go there and vote on those and have a voice. And maybe we can all play a bigger part in that policy change and just our overall health as a society. So I think there's
Yeah,
hope.
I definitely think, what was the name of it again?
It's I believe it's an RFK initiative called Policies for the People. The website is policysforpeople.com. And again, it's new. I
Policysforpeople.com.
just saw that come out this week. I don't know what will come of it. I'm hopeful. We'll see.
Well, there's no question in my mind that, especially since the COVID pandemic, that there is a very big movement toward uh, government and policies for the people, you know, and it's high time in my mind that the powers that be, the money, following the money, that there is a shift going on to doing things that are more uh, of value for those of us that maybe aren't at the very top of the heap. And I think that's this one example. And so hopefully that will flourish and hopefully there will be a lot of good that comes from that and many policies like that. But thanks again for your time and
Yeah, it was
thanks
fun.
to the viewers for participation. And again, let us know what you want to hear and like and share and do all those cool things. And we appreciate your time.
Hi, Dr. Saxena here, Chief Medical Officer at Form Health. Thanks for visiting our channel. Make sure to subscribe to get the latest insights and information on functional and integrative medicine.